There you go. Hey, I'm your host, Dr. Vavli, and you're watching Open. It's that live interactive program that brings the Bronx and New York City straight to your TV set, so stay connected to us through social media at BronxNet TV. Leading things off, our first guest is the founder of Anchor Group Corporation, Corp, and he joins us to share a go-to caregivers guide that can help caregivers in our community improve health outcomes and much more. So please put your hands together and welcome Kevin Howell. You guys can put your hands together in the studio and at home too. Here we go. Kevin, we'll do it.
Thanks for having me, bro.
Hey man, welcome. We're doing it like we have a huge live audience and we're on a big stage, but we are.
Indeed.
Because this is going all over the world.
It will.
So Kevin, you're no stranger to the show. Tell us about what you've been doing and what you're doing now.
No, it's interesting. When we start maybe 2 years ago, we brought the Care Star Awards, and that was focused on recognizing the home care workers.
Right.
This year again, we'll be having the Care Star Awards, but the book was one of our activities, the Anchor Group, a strategic consulting firm here in New York, supporting healthcare organizations across the 5 boroughs with efficiency and solutions to drive their growth, right? And so workforce is a big part of that. There's a shortage of home care workers in the industry. And so the ones that you have, how about training them so that they can be the best caregiver possible?
So take the ones that we have and retrain them?
Retraining is one thing, but continuous training.
Yeah.
And so the tool, which is Red Book of Care, Comprehensive Guide to Caregiving, really focuses on self-evaluation. So we're giving you information, and then we're asking you to evaluate yourself as a caregiver.
Yeah.
How are you doing it? Are you doing it according to the best practice of care? And so when we think about caregiving, there are 3 big buckets.
Yeah.
We have the individual who is employed to a home care agency. So that's a licensed home HHA, which is home health aide, or personal care assistant, which is PCA, right? Then you have the family caregivers, people who are taking care of their family. They're not getting paid to take care of their family. And then you have the CDPAP caregivers, right? The personal care, the personal assistants. And so this book was built not for any of those groups specifically. It was built for all of them because it's the art of care. It's the Bible for caring in the home.
And when you're caring, you have to take care of yourself too, because you see a lot of people fall short in taking care of everybody else,
but not
their
themselves.
health
And that's
suffers
a
little
big part in the book. Because we have mental health engagement, we have dealing with grief, dealing with loss, dealing with patients who have Alzheimer's, dementia. How do you manage your wellness in relation to those patients? So it was less about focusing on the client and more about how we make the caregiver healthier, more knowledgeable, and better, and by extension, drive care quality to the actual client at the end of the day.
Well, Kevin, how did you get involved in it? Did you have somebody in your family that you were taking care of?
So I've been working in the industry since 2018, and I've seen the gaps, right? I've always been friends with older people. I grew up in the church, so all the mamas and the fathers of the church, I was connected to them. So I'm comfortable with the aged, right, or the elderly, and by extension, finding a tool that supported them, but also find a tool that support caregivers. And I'm from the Caribbean. Most caregivers come from the Caribbean and Central America, right? And so it's also giving back to the community where I came from, giving them the tools so that I can be the best version of themselves, caring for others.
Oh, they were in my household for many years because my sister and and myself, we were taking care of my mom, but mostly my sister. I was just on call. I was like a doctor on call.
Right.
You need to go to the hospital. Because the ambulance that came, it took her to a hospital that she didn't need to go to.
Right.
So I had to come and get her and take her to where she needed to go, where our doctors were. And then we had people, from the Caribbean that
came and supported
the
work,
that took good care of her, and that she loved too, and that's important. There's that relationship that goes on.
Very, very important relationship. And so in the book, we have a section on dealing with family members. Thinking about the care team. The care team is not just your agency. The care team is everybody who touches that patient or that client or that family member. Because you spoke about your sister. What's interesting with that is, what if she had a book, the Red Book of Care? Could she provide better care to your grandma or your mom, right? Could she? And that's the idea. The idea is to put the tool in their hands that they can provide better care.
Right, right. So what made you want to come up with this book?
Because there's a gap, there's a need, there's a shortage in the workforce, there's a lack of continuous education. And as an organization, we believe that if you empower workforce with knowledge of the work that they should do, then they'll be better at it.
Yeah.
And across the kind of workforce continuum. So whether you're talking about your nurses or your doctors or your case coordinators or your administrative assistant, right?
Yeah.
They come to work every day, they're asking, what should I be doing, right? And so this book is specifically focused on the caregiver to say, hey, this is what you should be doing.
Right.
And you can digest this incrementally. It's a book for life.
Yeah, and not only for the caregiver, for the person
For
who
the patient.
for the patient,
Right.
for the hospital,
Correct.
for the doctors, the
Right,
nurses,
right,
everybody
right,
involved in this
right,
circle of
right.
care. Oh, that's a whole nother book,
Right,
The Circle of Care.
Yeah, indeed, indeed.
You gonna take it?
I mean, somebody else has it.
They have it already.
I mean,
You
one of
look
my
it up.
clients has a Circle of Care award. So
Really?
I can't, and that's one of the things that we came up with
Well, you
as an
gotta add-
organization for them.
You got to add another
Yeah.
name on the front end or the back end to make
Right,
it work.
right.
So what's next for you guys?
So what's next? So we are having a pre-sale of the book. It's $35 per copy in the pre-sale period, right? After that, it gets to $50. This year we're having the Care Star Awards again in August.
All right.
So we're looking forward to that. And by the end of this year, we're also going to have a Care Star app.
Yeah.
And that app is going to literally bring the knowledge and the engagement in terms of self-care and wellness, professional development for the caregivers in the palm of their hand in an app. So from the book, the awards, to the app. So that's
like
the
it.
journey for 2025 here at Anchor Group.
And that's part of the Circle of Care.
And that's intricate
Yeah.
to the Circle of Care.
Moving into like the multimedia part of it. Too.
Correct. And realize that most people are very excited about using technology this day. I mean, everybody has a phone.
Yeah,
Everybody uses WhatsApp. So now
You
we're
see the
bringing
baby,
the
the
knowledge.
baby carriage going like this.
Exactly.
You see them? Get that phone away from that baby. The baby's brain didn't develop yet, and you got a little phone in there.
I mean, it's a language.
Yeah,
And they're learning that language from their babe. So it's a natural kind of, like any language, right? A natural kind of engagement.
Where does AI fit in?
So immense, right? So as we think about AI, we think about when a caregiver is out there, right, and they're trying to understand what's happening, then they can ask the app questions, right?
Yeah.
And the app will be like a nurse provider guiding them through that journey. So definitely the AI is going to be critical with all the data that we have, and both healthcare data and practice data. We will be able to really drive more precise guidance to the home care worker who are often out there by themselves for 24 hours, for 8 hours, with a phone call to the agency. Now you have a phone call to the agency, but you have a live tool in your hands that can support the work that you're doing.
Now, inside the Red Book, does it mention that you should keep all of those phone numbers together?
Yes.
Because, you know, if you lose this, then...
So there is actually in the Red Book of Care...
Because you should remember your mother's number, your father's number, your sister's number.
Of course. Yeah. There's actually a contact sheet in the Red Book of Care.
Oh, you just write it in?
When you come, you say, this is my client, and your contact, this is their PCP, this is their specialist.
Yeah.
So there's a case coordinator. So now you have everything, not only the piece of paper, but you have it all in one place. So this is your Bible for care. This is your Bible for the life of your caring for your family members, for your clients, or for your community as a provider.
Oh, you just picture that person that's maybe not thinking like they used to all the time, and they feel like a bit confused about when they go to the hospital, they don't know all the language, or when they want to call somebody, they want to, and they feel panicked.
Right.
Sort of. So, but when they have everything right in front of them,
Correct.
then it's a lot easier for them.
Definitely. And
I'm just trying to put myself, whenever I go on stage, I try to put myself in the place of the person.
That is receiving.
I try to get in the audience to find out, how would this
would it
get on the other end? Yeah.
And so it's interesting, when we developed the book, the goal was to build a book that could become a relationship tool
Yes.
between the client
Yes.
and the caregiver.
Yes.
And so there's a section in the book called "Is Your Client Home Safe?" How safe is your client home? It's an assessment that we want the caregiver to do with the client. So you look at different elements of safety, and then they answer the question at the end. They can score themselves. They'll get up to 23 points. 23 mean that you're doing well. 17 to X mean that you're doing. So it's a scoring tool. It's a self-evaluation tool. It's a fun tool. The imagery in the book is just amazing. The graphic is intuitive because not everybody essentially can engage with information at the same level. So we wanted to incorporate a strong kind of graphic context within the book.
Well, you could tell you've been dwelling in this for a little while now because you seem to have all the edges shaved off.
Right.
That's good. That's good because it's a good feeling. People want to know. You know, this is the information age. Tell me something.
Tell me something. I think we can go on the internet and get information, but it's so amazing when you have this book. We have 3 nurses that has been involved in creating and reviewing the book. So we have Lana Goitberg, RN, Dr. Oliver Oakley, an RN.
Oh, good.
Then we have Andrew Brown, which has been working in the home care space for the last 20 plus years. Then we have a doctor of epidemiology, Jennifer Calder, who basically reviewed the book and did the introduction of the book. And then we have a professor, Professor Victor Brown, who basically, just to make sure that the content, he's a provost, but the content actually is consistent with what makes sense for learning, right? And so this is not just the Anchor Group just getting up and doing this. It's a collaboration with experts to make this book possible for our community.
Well, let's keep it going, man.
Definitely,
I love what you're doing. Thank you for all that you're doing.
Thank you very much for having me.
And everybody that he mentioned, and some people he didn't mention, thank you for all the work that you're doing in this collaboration. Kevin Howell, MBA, founder, Anchor Group Corp. Give me your social media website.
So it's Anchor Group Corp. Or the Kevin Howell if you want to get to me directly. Yeah, the Kevin Howell.
There you go.
So on Instagram and on Twitter and on Facebook, I mean, Kevin Howell. And the Anchor Group Corp everywhere.
Kevin, thank you.
A
God
pleasure,
bless
man.
you.
Good.
See
Thanks
you soon,
much.
all right?
All right.
All right, we'll take a quick break right here. I've got more open. Don't go anywhere. We've got you covered like a blanket.